Okay, we're rounding around. We've had the focus on treatment. We're getting close to the end of our time, so Donna and I are going to give a wrap-up of the two other recommendations that really highlight how do we pull this all together from an oversight perspective, and how do we really build broader capacity at the community level for the preventative strategies as well as the treatment strategies. So Donna's going to give you a highlight on what we're doing in terms of the commission work. And she comes to us as the overseer of the Missouri Council on Activity and Nutrition. It's currently supported through the University of Missouri-Columbia, the extension. Donna also carries several other hats at the university and the SNAP Ed program and some other initiatives. And she and I, once upon a time, crossed paths at the Department of Health and Senior Services. So we go way back, and we won't tell you all those stories. But Donna will tell you about the subcommittee's recommendation in relation to the commission.
Yes, and I'd like to tell you I appreciate being able to talk with you about this. This is a very exciting project, and I think it has great potential to improve the health of our children and, of course, Missouri's population as a whole. The recommendation was to develop a commission to oversee the implementation of the recommendations from the Children's Services Commission, to evaluate its success, and then to go forth into the future with what needs to be done at that point in time. And why should this group exist? One is we know that obesity is a very complex problem, requires lots of different approaches and impacts, and we do need an effective way of collaborating in the state, and we do want to strengthen and align our services with policy and environmental changes in our state as well. In terms of the steering committee, what happened was, in terms of this recommendation, we got a group of people from the actual subcommittee to come together and discuss how we wanted to go forth with this recommendation. And we call that our steering committee. And so in terms of the steering committee, what they first did was we did develop our operating documents, our mission, our vision, our guiding principles, how we're going to work, what we expect to accomplish. And then we started talking about what group how should we implement this recommendation? What different options do we have? So we had a list of different options. And so then what we did is we, as the last step, we went forth to choose that option by evaluating it. We did this virtually, of course, by phone, and then we also did these discussions in person at meetings. And so the group that was chosen to go forth and be this commission at this time, because we know that things do change over time, and there may be another group that emerges at some point in the future that would be a better fit for this recommendation or this particular action. But the Missouri Council of Nutrition and Activity, or MOCAN, was chosen as the best option at this time. And the reasons for that was because MOCAN has a long history. It's been in existence 10 to 12 years. We have a committed, passionate group of partners who come together and work on different projects together. I tell everyone MOCAN has wonderful partners. We have 7 work groups, and each one of those work groups is led by a chair and a co-chair. And then that chair, those folks come together as part of the MOCAN steering committee to head the organization or to guide the organization. And then we do have some other at-large members as well. Of course, I can remember the day that we made this decision because we were in the governor's office building in Jefferson City, of those of you who have been in meetings there. And you know, MOCAN is a small part of what we do at the University of Missouri in our SNAP Ed program. And fortunately, the Missouri Foundation for Health has provided some funding for us to have some additional part-time assistance. But that was really based on past needs and not current needs. So when the decision was made to adopt MOCAN as the commission entity, I mean, talk about blood pressure. So the first thing that I did is after I talked to my management, I did mention that we probably would need some additional staff time. So fortunately, my organization, University of Missouri Extension, stepped forward, and we will have another full-time coordinator, a new coordinator for MOCAN and the commission work, and that person will be starting at the end of July. We are another reason why MOCAN was chosen as the best place to do this is that MOCAN is very interested in meeting the needs of the partner agencies. We periodically survey our members to assure that their needs are being met, to look for new needs that we have, that have emerged, so that we can work together to help all of us in our individual spheres of influence as well as the bigger, broader picture. And so we are currently looking at the Wilder inventory factor, inventory tool to evaluate the impact of MOCAN for member organizations. Plus, we're getting some social networking questions together as well to help us better coordinate and move forward into the future. So we're hoping to have that done in terms of by October, I would say. And then the other thing that we are doing is that we are developing and planning what it is that we need to do to meet the functions that were assigned to the commission. And as part of that, we had a Master's of Public Health student do a literature review of successful coalitions and successful groups. And she reviewed like over 80 articles. And we're culling those down to find out which one of those items we need to work on in MOCAN, which are the facilitators, and then what barriers do we need to avoid. So that's currently underway. Now, the potential goals of this particular commission is to, of course, these are just potential. These are things that the commission will choose, or MOCAN will choose on behalf of the commission functions. Collaboration is key. We all have to work together in all spheres of influence to really make a change. It's a cultural, systems, environmental approach, and those are the changes that we are needed. The other thing that we'll be looking at is how are we going to transmit that shared knowledge to the rest of our members and to the providers and other state folks in Missouri.
And as we look at some of the potential for the cross-sector goals, one of the recommendations, as Denise gave us a brief overview, was for schools. So there has been the increase in school wellness policy work at our State Department of Education. And we're, again, thankful to our foundations for support. And we're also very happy because of that capacity. That individual was able to secure one of the 5-year CDC grants. So it truly is starting to leverage our funding, and our focused efforts is leveraging other sources of funding to support this. And we look at opportunities for integration. There's always been this controversy: do you collect height and weights in schools, and what do you do with that, and how do we best manage that? And by building a treatment network, then you actually have some additional benefits that you can realize. Because if you collect the screening data from a public health perspective, if we don't have anything to do with that or any place to refer these individuals at high risk, it has limited value. But if we start building a true viable treatment network and some alternatives for the children and the families that are dealing with this problem, we have some potential down the road for some really unique and appropriate cross-sector collaboration to build off of this. I'm just going to spend a minute on the fact that one of the other recommendations was, how do we build our capacity at the community level? And it was to create centers of excellence. We want to see these centers of excellence basically as an academic institution that will be focusing on how do we train the healthcare force, how do we train the community force, how do we translate physical activity guidelines and supports, how do we have that evidence-based and evaluation capacity available. So there's a broad realm of activities that we envision for those commissions. And we basically one of our subcommittee members was actively engaged in doing models of care for the autism spectrum disorder, because in 2007, when they started, it was an underdiagnosed condition with good behavioral approaches, and so they identified through these centers of excellence that they were really able to build that capacity to improve diagnosis and to improve treatment options for those children with autism. And there we saw real parallels between what was going on in the autism spectrum disorder area and what's going on in obesity. And this just highlights that we certainly have a much emerging evidence to support the need for these centers. We have family involvement is critical. Early intervention is the best approach, truly a preventative strategy. We don't have enough providers currently to address, and we're ready. There are some partners that are ready to make these changes. So that's what I wanted to say about that recommendation for establishing centers of excellence. That's still down the pike. The Centers of Excellence for Autism get state funding. Missouri's not quite at that point where I think we'll get that investment from state, but we'll continue to look for sources of those funds to build that capacity. As we do the pilot for our treatment, I'll just highlight that we are tracking our outcomes. And a key one would be looking at our claims data. Do we see an increased proportion of the Medicaid population that they're getting claims, and then how many of those refer for family-based treatment and medical nutrition therapy? And we too embrace the socio-ecological model. I think we've highlighted several strategies that address the policy arena, from the child care regulatory realm to MoHealthNet policy to providing supports for local school districts for their school and wellness policy, with the eventual targets being those professionals within our organizational systems being better equipped to implement the evidence-based strategies, as well as facilitate individual behavioral change and changes within the environment and the community to support those behavioral changes. And our grant team, we had, for this specific pilot, we have the blessing of a variety of very competent, lovely people to work with to help us advance these goals. And then obviously we want to acknowledge our current funders and the investments that are being made in this cross-sector collaborative. So I believe we're at the end of our time, so we're going to go to break, but the panel members are here, so if anyone has particular questions, we'd be happy to entertain those one-on-one. And thank you very much for your time and letting us share our journey.